Hey everybody, this is Tim from God, Guns, and Good Times. This is episode number 3 of my Hurricane Preparedness series. In episode 1, guys, I talked about power and the importance of making sure we have enough power when your electricity goes out due to one of these massive storms. Episode number 2, I touched on something that gives life, and that was water. We talked about from a fire standpoint, from a mechanical standpoint, and from a chemical standpoint, how to make sure we have great water around us, potable water that we can obviously survive on. And this week, guys, episode number 3 is going to deal with medical supplies. But before I get into that, I want to give you my opinion about this. Medical supplies are great, and you're going to see I have a bunch of them. I don't have them all laid out here, but I've got a lot of them laid out here, representative of really what I have. But that's all they are. They're just medical supplies. If you have no idea how to use them, you just wasted money on medical supplies, some would say. So my recommendation to you is absolutely get some training, get a qualified person to train you, whether you go to a local community college and take a first aid course, or if you take a kind of a pre-EMT course at your local community college. They're very inexpensive. But you're going to be armed with the knowledge that's important to hopefully save someone's life, whether that's one of your friends or your family members or one of your neighbors should one of these major incidents happen. So I'm going to go over different aspects of medical supplies that I have. We'll talk about them and see if any of this stuff fits into maybe your method of thinking. But also think this, guys, maybe you don't really know a lot about medical and you're interested in taking a course, that's great. But also having medical supplies around for other people to use, maybe even on you, is important. I mean, we all go to the shooting range. We all bring our guns. We all bring our targets. We all bring our ammunition and so forth, and our shooting glasses and our hearing protection. But how many of you guys actually bring one of these to a range when you guys are shooting? This is just a cat tourniquet. I would venture to say that not a lot of people do. Well, what happens if there's a ricochet? What happens if someone gets shot? I know I'm not talking about hurricane stuff here, but preparedness is preparedness. So make sure that whatever equipment you have, make sure it's around and it's ready to use, especially if one of these big storms happens to roll up on you, whether it's a hurricane or a tornado, as we've seen. We've seen desperate flooding now in Houston, massive amount of damage in Houston due to a freak rainstorm that just hovered over that portion of South Texas for days and days and days. These are things we need to really think about. So medical supplies are great to have. They can save lives. But get the training to use them, and there are a lot of great places. I recommend, again, community colleges. Look around your neighborhood, your community colleges in your area. Do a search for EMT training, basic first aid, CPR. And don't forget, there's children involved, so you may want to take a CPR course for kids as well. But if you're looking for some other really good professional training, I would highly recommend you check out the Patriot Nurse. Go out to YouTube where you are and search for Patriot Nurse. She's got some awesome classes. She travels around the U.S. and she does a series of really good classes. I have not had the privilege yet to take a class with her, but I am going to do so. But I have taken classes locally at community colleges in the past for simple medical training and first aid training and some EMT basic training as well. I highly recommend you do that, because you know what? When the blood starts flowing and chaos is all around you, you're going to revert to your training as the level of preparedness that you have. It's great to have all these supplies, but using these supplies when the blood starts flowing and the people start screaming and the fires start burning, that's a completely different thing. And I don't know that we ever can be totally prepared for that unless we experience it. But you're better off getting training than certainly not having training. Hey guys, I'll be right back, and I'll start walking you through some of the stuff that I have, and we'll go from there. See you in a bit. All right, guys, so I've got the camera here focused on my table, and I've got a bunch of stuff sitting here. This is not representative of everything that I have, but it is representative of most of the stuff I have, but I've got a lot more, obviously, to support more people, but I just didn't have the room to put it all out here. So the first thing I want to really talk about is kind of really critical tools to save people's lives. As you can see over here, guys, I've got a bunch of cat tourniquets. Be very careful when you buy these. Number one, they have expiration dates on them. I don't know how valid they are. I've talked to a lot of people that say, you know what, the expiration date is not really the most valid thing about a tourniquet. Obviously, if they're kept dry, they're kept clean and whatnot. But what I will say is this, guys, there are tons of fake cat tourniquets out there on eBay. Be very careful. If it seems awful cheap, guess what? It is too cheap. It is Chinese made. And you will find when you crank on these windlass to tighten this down to save actually someone's life, you're going to end up breaking this windlass, and now you're in deep trouble. So I've got a bunch of these cat tourniquets around. Now I take these things shooting with me as well, meaning I have a whole, what I will call a blowout kit that I take with me to the range in case something, God forbid, happens to myself or someone around me. So we'll talk about that a little bit later, but you can't go wrong with having a cat tourniquet around. There's also some other tourniquet makes out there, some really good ones. I just happen to use these cat T tourniquets. I will say this, I've never ever and I hope I never ever do have to use one of these on someone. But guess what? I'd rather have it than not have it. However, I have gotten trained on how to use these things. Again, in my intro to this, guys, you need to get training. Absolutely get training. Again, do no harm is obviously the mantra whenever you are dealing with this kind of stuff. So, I've got cat tourniquets. You can buy them anywhere. Again, make sure you get the real ones. Don't buy them from overseas because they're fake, period. I also have a bunch of Israeli bandages, as we call these, trauma wound dressings. This is a 6-inch hemorrhage control bandage. It has a little plastic lever on it. You wrap it around, hook it up into the 2 plastic hooks, and these are obviously also, they have expiration dates on them as well. But again, the expiration dates on these things really not that important as long as they're not opened and so forth. These are airtight. It's a cloth bandage. These are absolutely vital, and these things are a couple dollars too. You can get these on the internet. You can get them obviously on eBay. Be very careful. You can go to a guy like Skinny Medic. Look up Skinny Medic on YouTube. He's got a lot of great medical kits. You can buy these. They're fairly cheap, and let me tell you, they will save lives. Put pressure on the wound, tighten them up, and save lives. That's what this is about. I probably have 10 or 15 of these things laying around. So that's tourniquets and pressure bandages and whatnot. Now, obviously, guys, I have a whole assortment of other kind of 2x2 gauze bandages and 4x4 gauze bandages. And I've got 6x6s, 8x8s, bigger ones. Again, I don't have enough room here to show you everything, but make sure you have an assortment of gauze bandages. These are great for mild abrasions and cuts and burns if you want to put ointment and cover them up to keep things clean. I've got abdominal pads in here as well. These all came as part of kits, guys, various kits that I've purchased from various companies. So I've got that. Obviously, I've got some gauze wraps. I have also in this kit over here, which I'll show you in a little bit, I've got like an ace bandage type wraps for that. And of course, I've got some rubber tubing if you need to use rubber tubing to control bleeding, or if you're going to administer some form of a a shot, a needle, and so forth. Again, if you're trained. I've got rubber bands and paper clips for ace bandages. Again, I've got some simple tools. Guys, I'm not a doctor, but I've got simple tools out here. Just simplistic tools, hemostats and tweezers and scissors, medical scissors here. I've got some paracord if I have to tie somebody's arm up into more of a sling out there. And then, of course, I've got an assortment, just some stuff laying out here. I've got bacitracin, zinc ointment, an antibiotic kind of a makeup. I've got some alcohol pads. I've got lubricating jelly. I've got iodine, povidone, swab sticks here as well. This is great for, if you're getting ready to do any kind of stitches, which I've been trained to do as well. That's why I have right here. I've got monofilament sutures, 5/0 and 4/0. Of course, I was trained to use those as well. Just got a couple of those here for you to see. I've got some blood stop chemical that you can use to obviously stop arterial bleeding. Of course, you're going to need pressure and tourniquets and all those other things, but that's something nice to have. I've got emergency blankets out here, keeping people warm, keeping them from going into shock. Man, that's vitally important. I've got a bunch of those. I also have some body warmers and hand warmers out here in case I need those. Northeaster storms, guys, and hurricanes. You can't tell when they're going to come. Northeasters blow up the coast where we are in the middle of winter. So keeping people warm is very important. I've got, you know, baby wipes in here as well. Just little packs of baby wipes that I keep around. You know, and then, of course, I've got hand sanitizers and Tums. I've got, obviously, some lip stuff here, Blistex. I used to be, but I'm really not now, someone who had exercise-induced asthma. Can't remember the last time that I had to use this for that, but every now and then, I'll get a bronchitis or I'll get sick. I'll need something like that to open up my lungs. Maybe someone else does as well. Asthma seems to be all over the place now, so I keep one of those in there. I've got your basic cough drops here, guys. Just showing you a little sampling of some basic CVS, Rite Aid kind of medical stuff. But then, guys, I have saline in these little, you know, these little syringes. Saline, it's got normal saline solution for rinsing out cuts, cleaning them up. I've got a sprinkling of them around. I also have some syringes, and I have, of course, the actual hypodermic needle ends that go on them as well for doing other things. I've got some surgical blades here just in case you have to cut something, unfortunately, to clean out some dead skin, necrotic skin, or flesh or tissue. I've got that. And again, guys, let me just say this. If there's a doctor around, I'm not using any of this, okay? I'm not a doctor. If there is medical help around, a medical professional, nurses and doctors, this stuff isn't coming out. This stuff is only going to be used if there is a dire emergency and I've got to repair my kid, or someone has to repair me, or my neighbor is in big trouble and I need to stop bleeding, or this person's going to die. That's the only time this stuff is going to come out, with the exception of maybe something like Tums or hand sanitizers or a blanket, those kind of things. The rest of this dire emergency stuff, I am not professing to be a medical professional or a practitioner at all. That's why those folks go to 8, 10, 12 years of school, whether you're a nurse or whether you're a doctor. But guess what? In a situation where we have a grid down situation and we have a storm that's wiped out areas, and guess what? That medical help can't get to you for whatever reason. You think I'm not going to use some of this to attempt to save someone's life? Absolutely I will. But that's the only time I will use stuff like this. So I just wanted to get that out there before I hear the comments like, hey, you're not a doctor, you shouldn't be doing any of this. You're right. I'm not a doctor. I shouldn't be using this stuff if there is medical help around, and I would not use it if there's medical help around. But guess what? We've had storms here where we live, maybe where you live, devastating storms, and there is no one around for days. Well, what are you going to do? You're going to sit there and let someone bleed to death? Are you going to put a tourniquet on them? Are you going to put an Israeli bandage on them? Are you going to suture someone up? Blood stop? What are you going to do? Are you going to let them die? Well, I'm not going to let them die. I'm going to do my best to save their life. And hopefully someone could use this on me to save my life as well. So, just to clarify that, that's why I have needles and syringes and those kind of things, blood stop around. I also was trained to use these, and these are really inexpensive, and let me tell you, I've used this on me before. When I've been fishing and I cut myself and I'm out in the middle of the ocean, guess what? These are skin staplers. These are inexpensive, maybe $10 each. They come all preloaded with staples. They're completely sanitary. And also I have the removers. And guess what? These things don't hurt at all. You just simply pinch the skin, pop, 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 and next thing you know, your skin's back together. And this is truly something that I would recommend people have. These are made by Oasis. You can find these in medical supply places on the internet. You can find them on eBay. Disposable skin stapler, reorder number 35R. These are the ones that I use. and these are the ones that a doctor told me are the best product if I have to ever do that. And I've used this personally on myself, and I was amazed how it didn't hurt. I don't know whether it just shoots out so fast that you don't know, but it actually shoots in your skin and closes in the back, just like a regular stapler would. You wouldn't think that, but it does. I don't know the technology, and guess what? I don't care. They work. So I've got a couple of those laying around as well. Just as, again, a sampling of what I have. Now, I also carry just a simple first aid kit as well, and I get these bags. You can buy these bags anywhere. You can spend as much money or as little money on these bags as you like. This bag has full Velcro on the back, and it comes with a tray, and I have the tray on a bug-out bag, and I just, boom, stick it to it and tie it down. Notice I have the Red Cross on there, so if I'm unconscious, somebody knows, hey, there's medical supplies in there. And this is just more of a first aid kind of a bag in here as well. So I've got some blood clotting sponges. I've got another Israeli bandage, some tape, more gauze wrap, some tools. I've got 4x4s and 2x2s and 6x6s in there. And then I've got a whole sampling of Band-Aids and cold compression kind of things in here, antacids, all of that kind of stuff. So just general first aid kind of things that I keep in here with some bleeding or some blood eradication kind of chemicals in here. This blood quick clot, I think I got these at Cabela's. You can get this stuff at Cabela's. Be careful with this. You can buy this stuff on the internet like combat gauze. Just be very careful with this. This is a chemical, guys, and you have to make sure that this stuff doesn't expire. You can find this really cheap on eBay. Look at the expiration date. Again, I've heard mixed things about it. As long as the package isn't open, it's not a big deal. I don't know. It's a chemical. It's up to you. So make sure, again, get some training, but make sure you buy the right stuff. But anyway, that's what this one is all about. I just keep this for general first aid. If, someone needs to gain access to it, me or someone else, there you go. Also, guys, great to have one of these first aid kits in your car. If I travel, I always take my, what I will call a preparedness bag, because I really don't want to bug out anywhere, but that's what it is, and I keep that with me at all times when I travel wherever I go for work. Now, I also have, in particular, a range bag as well that I take with me. I call this kind of a blowout kit for the range, guys, because at the gun range, especially if you're taking any kind of tactical training and you're moving and you're shooting and there's people all around you, guess what? You could get shot. Okay, very rarely does it ever happen at a good training environment, but you never know. Or even if you're at the range shooting at paper targets. I can't tell you how many times I've been to an indoor range shooting handguns, and some joker's shooting a handgun and he's hitting the frame that holds the target, and you can hear it just pinging off the frame. That kind of stuff weirds me out. I don't feel like getting shot. And if someone does get shot, I want to at least have some equipment there that I can use, but also a medical professional who may be there can use. And more importantly, if I'm the guy on the ground shot, I want to have the stuff here so people can hopefully save my life. So again, I've got combat gauze. I've got little vents here. These are, chest seals, a twin pack front and back in case you have a through and through shot. Okay, again, we want to really protect ourselves and have this stuff available just in case. Tension pneumothorax, all of these things, the killer. Okay, we can save you provided you don't get shot in the heart or something crazy like that, or it takes your aorta. But if you get shot in the chest, these kind of things can save you. Now, I don't have this open, and I'm not going to open it, but this is what, and I got this from Tactical Response. If you go to tacticalresponse.com, they're an awesome training provider down in Tennessee, and they have a store down there, and this is called an Operator Trauma Blowout Kit, and it comes with a compression bandage. It comes with a chest decompression needle with instructions. Again, that is not something you want to take lightly. Okay, you need training to use a needle to release the pressure on someone's chest so they don't basically drown in their own blood and die. you need to know how to use this. But again, I have this more for me. If I get shot, hopefully someone else can use it on me. But if someone's laying there and they're dying, I've got some training on this stuff, I'll use it. But again, I want to clarify, this is some serious stuff here that you really need to get training. So it's got the decompression needle, it's got a pair of trauma shears, nitrile gloves. It also has the naopharyngeal airway, the airway tube, and it's got some lubrication for that. Alcohol prep pads, and it's got another quick clot in there. Guys, these are invaluable to have if you're a shooter, and I don't care if you're just shooting tin cans in the backyard, because a 22 will kill you, or you're shooting big bore rifles at 200, 300, 400 yards. You never know what can happen. Certainly if you do any kind of heavy duty training, these are great to have. But also, guys, you know what, in a storm situation, having this stuff around, you never know when a tree limb could fly in the air and stick you right in the chest. Crazy stuff happens when these kind of natural disasters happen. So this can also be something that's important to have around. Now, I also have one of these as well in every gun bag that I have. So no matter what gun bag I have and I'm carrying with me, I always have one of these, because you never know. It could save my life, or it could save someone else's life around me. So that's just a little kit that I put together. This is a little Maxpedition little kit that I have on there, and I've got some of these Molly sticks on there to mount it wherever I need to mount it. So that's kind of it. That's just a sprinkling or a smattering, whatever the word is, of stuff that I keep around, and the reason I keep it around. Again, the final thing, guys, in a grid down, all-out crazy situation, if you have the training, you can make someone's life better, and that's what it's all about. Whether you're out and out saving someone's life, or whether you're cleaning out some kind of a wound and putting a little stitch on it and hopefully, it won't get infected. Whatever it is, even a scrape, just having this stuff around for morale purposes, trying to help people, that can make the difference in all-out devastation, both mentally and physically. Again, though, you need to get some training on this stuff. Look to your local community college. Look for EMT training, basic first aid, CPR for kids, all of these different classes. Look to the Patriot Nurse. I'm telling you, she's amazing. And by the way, if you look to the Patriot Nurse, check out Valor Ridge as well. Get yourself trained on using your guns. Valor Ridge is an awesome place down in Tennessee where you can get some training as well from Reed Hendricks. And I believe Reed Hendricks and the Patriot Nurse are together. They are a couple, and they do a great job. So one will teach you how to shoot. The other one will teach you how to fix yourself up if there's a problem. I highly recommend, guys, get some training. But have the stuff around. You never know when you're going to have to use it. Because if you're the only one with this stuff, you should be using it. Again, get some training. Hey, guys, this is Tim from God, Guns, and Good Times. Episode 3 of Hurricane Preparedness. Episode 4 coming your way. You know what I always say at the end of this. Hey, guys, God bless this country we live in. Keep it safe. Keep it healthy. Do your best to make someone's life better. See you next time.